The following program was produced by an independent community producer. The opinions expressed do not necessarily reflect those of the Weymouth Community Access staff or its board of directors. WCA, in compliance with FCC regulations, is prohibited from exercising control over the content of independent member-produced public access programming.
Hello, how are you? This is a good color, Dr. Wolfert.
I think it's beautiful on
Thank
you,
you,
Phyllis.
thank you. I've had it for years. As everybody says, you have been on the show a couple of times. We talked about implants. I
Yes,
think
we
we
did.
talked about false teeth.
Right.
Your name is Richard
Officially, yes.
Richard Wolfert, W-O-L-F-E-R-T.
Yes, AKA the Toothboss.
The Toothboss.
That's right.
And where are you? Tell people where you are.
I'm at 1121 Main Street, which is Route 18 in South Weymouth.
It's
Right
busy,
across the
that.
street- Yeah, it is. Right across the street from the 99 restaurant.
Are you really?
Right past Stockholders Restaurant.
Okay, Stockholders is just recent. It was a few different restaurants,
Oh, yeah,
wasn't it?
the Village Diner way back when.
I think the last time I was there, Rosalie and I went, or maybe my son-in-law and daughter, I forget, but he owns the Inn at Bay,
That's right.
Yes.
He owns the Inn at Bay Point, that's
and
right.
it was a nice experience. So you're on that same side? Or
Same
across?
side. If you get to the entrance to the base, which is now called Southfield, you've gone too far.
Okay, and you, tell about you. I appreciate your service to our country.
I'm a general dentist primarily,
Yes.
but I have been in the National Guard, Army National Guard Reserve for 34 years now.
34 years.
That's right.
Were you ever in Iraq or Iran?
I spent 3 months in Iraq in 2004.
We have to do a show about that.
Well, we could.
Yes.
That's right.
And you were working on teeth?
I was primarily a dentist, but we also had duties as if there was a mass casualty, we would go in and we would decide if a patient needed to be seen right away or could wait. That was one of our
Not
duties.
about their teeth, but about
No,
general health.
And luckily for me, there was a lot of really skilled paramedics around that could help me out because that wasn't my
Expertise.
field. But it was better that I did it than the physician did it because they needed the physician to treat the soldiers when he was assigned. So
I thank
was
you for
hard.
your service.
You're
Well, you
welcome.
have a patient, and Rosaline's going to call you as soon as she
well,
can.
we hope so.
Okay.
Hope so. Let's see what he.
Have you been a dentist for a long time?
Yes, I've been a dentist since 1981. I went active duty in the Navy for 7 years. And then when I got out, I stayed in the reserves and I switched over to the Army National Guard Reserve thinking that, the National Guard basically covers the Massachusetts. And I said, well, I better do that rather than staying in the Naval Reserves, who could send me. It was just the beginning of Desert Storm, and I was afraid. I just started the practice. I was afraid I was going to be sent.
You probably would have been.
Might have been. But then, then the philosophy of the National Guard changed, and they decided that they were going to start to send people like myself. So as it turned out, I was sent, but just for 3 months. It wasn't difficult to manage, although leaving my practice behind, leaving my family behind, that wasn't easy, but it was easier than going for a year. Some of these people are gone, some of these soldiers are gone for 18 months. That must be a real hardship for them. So.
And thank you for your service. I think that
You're
is
welcome.
something. And you are going to talk about, and you are wonderful, the Toothboss dental exam.
That's right. I think that I do things a little bit differently than most dentists because the first person that the patient sees is me. And a lot of times when you come into these, particularly the larger organizations, the larger group practices or the larger organizations like Gentle Dental or Aspen Dental, they're going to bring you in through the hygienist who cleans your teeth and takes the x-rays. I never felt good about doing it that way. I always thought that before I treated a patient, I wanted to do a diagnosis first. So I bring them in and we talk a little bit. I try to make them feel comfortable because...
Are they scared? Are they frightened?
Most are. just because I'm new to them.
Yeah, apprehensive.
Right, and some are because they've had a bad experience. So I try to elicit that information. Who did you go to before? What kind of experience have you had? And those kind of things. And then I ask them if they have any current problems that they want addressed right away. And if they don't, then I start my examination process. And the examination for me starts with a blood pressure. So the first thing I do is I take a blood pressure. And the reason for that, I have a little story that I always tell them, because how many dentists really take your blood pressure unless you're going to the oral surgeon to get teeth removed, a real surgical procedure? The reason I do this is because when I was in dental school, they sent us home to learn how to take blood pressures. And so I started taking blood pressures on anybody that came in the door. So I took it on my mother, my father, my brothers, my sisters, so forth. Well, I kept getting this high reading on my father, who was, I don't know, he was probably in his 60s at the time. And I said, you know, I'm not sure this is right. So I went to talk to my professors. They said, you need to send him to the doctor right away. So I did. And it turns out that he had high blood pressure that was chronic, and they put him on medication right away. And the doctor said to me, you saved his life. And ever since then, I take blood pressures as a screening service for all my patients. And I've caught a few. You know, sometimes you don't know if they've just got white coat syndrome because they're in the dentist's office, or they actually have high blood pressure. And, you know, after a little talking, we may put the blood pressure off till the end of the exam to see if it's as high. But that's the reason I do that.
I think that's marvelous.
So then after I'm done with the blood pressure.
Okay, and we're going to take that away. I think that was a clever idea.
All right. Then we move to the x-rays. Now, x-rays are different for every office. Now, these are conventional x-rays. I don't take these conventional x-rays anymore.
What does conventional x-ray mean? What does that make
versus
difference?
digital x-rays.
Oh, okay.
Okay, so digital x-rays are taken with this sensor. And the sensor actually takes the information and puts it into the computer.
Does this go in your mouth, right?
This part here goes in your mouth. This part here goes to a computer, hooked into a computer. So I use this device to help me line it up. And we line up every x-ray. I'll take 18 x-rays. Now, people will say they're small and they're detailed, okay? They're small like this.
These teeth, these are, how many teeth do you have in your mouth?
32 teeth.
32 teeth.
At the most. And we'll take an x-ray that completely covers your whole mouth. Now, they're more detailed. There's another x-ray called the Panorex. And a lot of people will get the Panorex done because it's easier. And
what does Panorex mean?
Panorex is another type of x-rays. This is called the full mouth series of x-rays that I use this instrument for. A Panorex is where you stand in a booth and the x-ray beam goes around you like that. And
you do that for implants, don't you?
Yeah, it's a great screening exam. It's a great exam to screen, but these type of x-rays are more detailed. And I need a more detailed look. I prefer a more detailed look so I can do a really accurate diagnosis. So I'll take about 18 x-rays, and some of them overlap with each other. And this gives me a real thorough look radiographically at what's going on in your mouth. So I'll take that, and sometimes at that point I'll discuss some issues that I see. Sometimes I don't, because once I take them all, they show up right away on the computer.
The computer's right next to it. Yeah.
In my operatory. Versus in the old days, we'd have to send it to the dark room, you know, develop them, and then it would take 10 minutes before I'd see them. These I can see immediately. So it's a great thing.
And you can read it. You can tell.
Read it.
I'm always amazed because you can, of course, you go to school for that. You can tell if there's something wrong.
Yeah, the nice thing about digital is that we can also make them any size we want. So we can blow them up the whole screen if we want to. And you can really take a look.
One individual?
One individual.
Is that right?
Yeah, it's great. It's great.
And all this equipment must be a fortune.
Well, this happens to be fairly expensive, but I think, you know, if a dentist doesn't have digital now, I mean, I've been doing dentistry for over 30 years now.
30 years.
And if they don't have digital now, they're probably a little bit behind in what they're offering their patients, because this is the way to go nowadays. It gets rid of, first of all, it's lower radiation. Secondly, it gets rid of all the chemicals in your office. You don't have to develop anymore. And thirdly, after you get to learn to read it, it's easier to read, and I think it's it's better. You can see much more.
And you can tell this
Right
person
away.
right
Yeah,
away
right away.
what this person needs.
Right away.
Okay,
Right away.
and you say lower radiation, not good to have.
Well, if you
want to be careful.
No, the old ones weren't that bad. But when you went into the dentist's office and he lined up that X-ray, and he used to go out of the room and he used to push
Yes,
the button.
yes.
So when you heard that button go off, it was bzzzt, right? Now with digital, it's zzzt, that's it.
Oh.
So that's the amount of radiation that you're getting versus the old type. It's still, the old type was still not that much. This is even less. So I think this is the way to go.
And gloves, the dentist said years ago,
gloves,
I think.
universal precautions are the law now.
Is that right?
The law, you have to wear gloves, you have to wear a mask, you have to wear long sleeves smocks.
I didn't know that. Is that
That's the law.
right?
Yeah, OSHA really has taken a hold on dental offices and made sure that we're up to speed on everything.
Is
that
it
we do.
because can you as a dentist contact a lot of things?
Well, there's two big diseases that we're afraid of. One is hepatitis, and the other is AIDS.
AIDS,
and
yes.
Neither one.
Hepatitis is what, Dr. Wolf?
It's a liver disease. It's a blood liver disease. So it's something that will really, I've watched people pass away from hepatitis. It's awful. It's an awful way to go.
And you could catch it?
I could catch it, and I could also pass it on to my patients. So those are the two things you don't want to pass things on.
Yes.
And obviously AIDS is the other one.
Yes.
So we take universal precautions. I think you'll find that 100% of the dentists do that now. They can't get away with not wearing gloves and a mask and long sleeves.
Do the gloves get in the way of you? Do you
Not now.
mind them?
I mean, I've been using them. I think when I was in dental school, we weren't required to use gloves. That was 1981 when I graduated. By 1983, I was in the service. They made us wear them. You get used to them. You learn to find the correct size. I have small hands, so I wear a small glove that's really tight, and I've learned to be dexterous with those gloves. It's just something that you have to learn.
I think that is wonderful. And what is this now?
So the next thing, after we take X-rays, I also take photographs.
Ah.
I'll take 6 photographs.
Why?
For reasons, first of all, for documentation. Secondly, I use it after I'm done with all the procedures of the day. I'll go back into my office and I'll write up a report for all my patients. And I use those pictures to refer to. So I look at the pictures, I look at the X-rays, and I develop a treatment plan for a patient. So the X-ray, the photographs show things that the X-rays can't, like how big is that filling, like how red are those gums, like
What about the jaw alignment? Well, things like that.
Yeah, like how crooked are your teeth? What does your smile look like? Because we take a full face photograph. So we use the full face photograph for a bunch of reasons. One is to look at the smile. The other is to actually put it into the computer record so that some patients, I might see once a year, if that, or twice a year, we hope.
Well, twice a year, you say you hope because you should come at least twice a year.
For cleaning, yeah.
Yes.
If I see them
hope
twice,
so.
yeah. If I haven't seen them a lot, I may not know what they look like. So I can call them up and I can walk out into my waiting room and I can say, "Hi, Phyllis, how are you?"
Isn't that
It's
nice?
identification,
Yes.
so that I remember who you are. That's one of the reasons, particularly now I'm coming up on 60. Got to have all the clues of remembering things,
I
right?
kind of say, who am I every morning? Okay, name these questions.
Yeah, that's right. So after we take the photographs,
Isn't that lovely that you have, what a clever idea.
well, after we take the
And
photographs,
that's that tray.
this is the ultimate tray.
Now, where is the tray if I went into your office?
Tray's on my bracket, which is to my right, so I can grab it easily. I'm right-handed, so it makes it easy for me to handle. But so these are the tools of the trade: a mirror, an explorer, a cotton forceps, and a periodontal probe. And I'll explain about the periodontal probe as we go
The only
along.
thing I recognize is the Q-tip. Is that what it is? That's a
Q-tip
Q-tip.
and a
And
2x2, okay? The next thing I do is I'll sit the patient back, and we've done we're going to
Do
document.
you hurt me in any way?
No, I try not to. Not
Okay.
that first visit anyways.